So the other day we talked about anxiety and social anxiety, and I kind of just want to touch up with that because what goes with that is panic attacks. And more than likely, if you have social anxiety, or even if you don't, if you have any anxiety, you've dealt with some sort of panic attack and it's crippled you from being able to do what you wanted to do. So I wanted to talk about that. What are panic attacks? The best way to describe a panic attack is basically the intense feeling of something is fixing to happen. Okay. Or it might not be life threatening or anything, but something's fixing to happen. And it's reaction to that. Like your fear is so great that if you feel that it's something's happening, so you start having a panic attack where you're having a racing heartbeat, you're having shortness of breath, you're getting dizzy, you have muscle tension. I mean, you're feeling faint, like you're going to throw up, you're sweating. It's just all the things coming together because of an intense episode of fear. Fear causes panic attacks. Okay. Why is it a big deal? Well, because what we've realized is that many people have dealt with panic attacks and not even realized what they were. I've had friends and family that have ended up in the hospital at the ER having to get checked out because they've had the symptoms that I've talked about and no clue what it was. And the problem with this is that a lot of times people don't believe that's something that's real. If you're like, I had a panic attack, they're like, what does that even mean? So if you're able to tell them it's a fear that is instantly built up and it's sudden, it's something that is debilitating, it's something that is created from a fear that's happened. What triggers that? There's different thing that triggers that. It could be the simple thinking about having to do something or, doing something and not even realizing it bothered you, but it does. It's built up and it's kind of just lingering inside of you. And the sad part about panic attacks, they can actually take a long time to regulate after the actual panic attack. In other words, it may be a attack today, and you might be suffering with the symptoms for a month, 2 months, 3 months after. And the reason that it's important to talk about this is because there are many coping skills out there that help, but also there are many people that are out there that don't know what they are, don't understand them, and think that it's not anything, and it is. People have thought that they were dying because of a panic attack. Literally thought that they were having a heart attack because of the feelings that they had immediately. And when I think back to my stroke personally, and I can think back to the day that I believe I had my stroke, I could almost tell you that I was having a panic attack is what I would have thought because I had all the symptoms. I was dizzy. I was short of breath. I had a headache. Just a lot of little symptoms. I was sweaty. I couldn't catch my breath for nothing. And it mirrors also an asthma attack. It's not easy having something like this happen, especially if you've never had one before. And again, these are things that are popping up more and more, and we're finding now that people are having more panic attacks and don't know what to do with it. Well, what you can do with it is you can use coping skills to help you regulate the feelings before they actually get to the seriousness. So if you can identify the feelings, the symptoms of, if you can identify, the feeling of your heart starting to race, if you can identify that you're short of breath, or you can identify the dizziness, if you can identify those things, you can start to use your coping skills to regulate your body to then reduce the immediate effect of a panic attack. I'm not saying stop it. I'm saying reduce the effect. So what are they? What are the coping skills that you can use? First thing you need to do is when you're feeling dizzy, when you're feeling short of breath, when you're feeling that you can't catch a good breath, sit still, stay where you're at. Don't try to run somewhere or go somewhere or move or do circles. Just stay where you're at. And then start your breathing exercises. And that is going to be slowly breathing in and pushing it out. Inhale, exhale. Inhale, exhale. But you need to sometimes count that. So, 1, 2, 3, 4, 5. Again, inhale for 1, exhale for 5. I can't rightly show you that appropriately because I can't breathe and talk at the same time. Go figure. The next thing is that you can go ahead and start reminding yourself, this will pass. I am okay. I am safe. And you need to start using those positive thinking, those positive words to help yourself pull through what you're experiencing at the moment. A lot of times they tell you if you can lay down, close your eyes, maybe be in a darker room, a darker setting, and do your breathing exercises, start your positive thinking, and you have to verbalize it. Like you have to really tell it. I mean, maybe you don't speak it, but your mind has to be thinking this. Okay. But you will start seeing that it's going to go ahead and start calming your heartbeat. It's going to go ahead and start calming your dizzy feeling. It's going to, go ahead and help you realize that you are okay. It's going to help you calm yourself sooner. Now, you may continue to have symptoms for a while, but you are going to be calmer sooner. Okay. A lot of times I tell people, like I just said, say it out loud. If you are able to, in your head, say, I am safe, I'm good, I'm breathing fine, I do anything positive thinking, right? That's basically a mantra. Just go ahead and just keep repeating it over and over and over and over and over and over. Because telling yourself this over and over and over and over will allow you to start believing what you're saying. And that also will help reduce a panic attack. I know that a lot of times now you have a panic attack and all of a sudden you're rushed to the hospital and you're giving a quick script and they just want you to breathe and calm down, right? And that's great in the moment. But sometimes that's not what you have to do. You don't have to go to the hospital. You don't have to take the medication. You don't have to make it be something that you have to start a prescription for. It can just be you regulating yourself. And you might have to regulate yourself daily or a couple times a day for the next few days. Just continue to do the same thing over and over and over until you no longer have those symptoms of a panic attack. And if you know somebody that suffers from panic attacks, what I would like to believe is that you're able to give them this knowledge. You're able to help them. You're able to tell them you are safe, everything is fine, do some breaths, and you're able to guide them and walk them through this process. Because if you can be of support to that, and will make the person that's experiencing the panic attack a lot more comfortable sooner. I hope this, guys, has been helpful for you. I do want you to know that there's a very serious understanding that needs to be done with panic attacks. If you have any questions, please feel free to reach out. Remember also to like, share, and subscribe, and I'll be back. Bye, guys.